There were three presentations this morning, and two of them about graft-versus-host-disease and one about metabolic syndrome. The first one, which was given by Steve Pavlicek from the NIH, was a very impressive publication because chronic graft-versus-host-disease is a very difficult disorder to treat. It's extremely difficult to do clinical trials, and in large part that's because the definitions of the organs involved, the severity of the organs involved, hasn't been standardized. And he has been a very big part of the NIH consensus group to define the various organs that are involved, the signs that you might see, and assess the severity. And that's laid the groundwork for us now to be able to do clinical trials. So it's a bit sad that it's so long since we've had chronic GvHD that we're just starting now, but it was very encouraging. The second talk was interesting because it was on one particularly unpleasant aspect of chronic graft-versus-host-disease, which is that of the lung involvement. And that is really quite upsetting still because there's no effective treatment, either first-line or second-line treatment. But there was an interesting discussion about whether our patients could be referred for lung transplantation. And the final talk was on metabolic syndrome, which is occurring in a lot of our long-term survivors, but it's also occurring apparently in 25% of the normal population. So it's just that we should be aware of that, and as we follow up patients in late effects clinics, be prepared to look for this and ask their primary care practitioner to look after them.